seperti yang dijanjikan, part 2, pregnancy, pepot.
Dalam rumah.
Okay, so let me start part 2. I got married when I was 30. And then masa tu Nadia was already pregnant. 6 months. 4 months
4.
Four.
Umur berapa? Tadi macam glitch tak dengar.
Cuba teka umur Kak Long, komen di bawah. Tanda mengandung ya. Tanda mengandung umur dia berapa?
Nanti cerita ya.
Our age gap is huge lah
Huge.
She doesn't look like it.
So Nadia was still masa tu pregnant. Dia dah tahu, dah nampak perut dia. Okay. So masa tu one of my colleague pun baru dapat tahu dia pun mengandung. And then my boss wife masa tu tak tahu dia mengandung. Okay.
Korang ni apa cerita? Korang memang ada planning
So
dengan
dengar lah.
Selalu kan contagious kat tempat kerja macam itu. Siapa mengandung semua mengandung.
And then I went on 1 month leave after I got married because company kasih 5 days leave 5 days marriage leave. Tapi because I masa tu kerja shift. So I swap shift, I dapatlah sebulan.
Wow.
Honeymoon sampai sebulan Kak.
Patutlah
So
mengandung.
sekali balik-balik tu macam something is not. Actually bukan masa balik. Masa tu I was still at my husband's place. I was like, kenapa all of a sudden there's this one day I tak boleh nak get up. I just need to, kata orang tu rot. It's like I really need to baring. You know? I don't know why. So I assume that was the time that I conceived lah. Okay? So bila balik-balik tu rasa macam something is not right sebab selalu bangun pergi toilet, everything kan. But I tak ada muntah-muntah whatever. So we test betul-betul pregnant. Then bila balik office tu cakaplah dengan my team leader. Wah, you shotgun wedding ah. Shotgun wedding ah. Yalah, kalau orang Melayu kata bunting pelamin
By that time kita reveal macam mana I'm blue. Then she said I'm blue. That time we were using that time kita chat Kita chat
MSN lah kan.
Yeah, I'm blue. Then after that she said I'm blue. We go like what?
That time
So,
pun dah
masa
ada gender
tu,
reveal lah.
Belum. So masa tu my boss pun dah kasih tahu, actually masa your wedding tu my wife dah mengandung.
Siapa?
Cik Osman lah, Kak Linda.
Ya.
Hai Cik Osman, hai Kak Linda. If you're watching.
Yeah, so and then memang the year after tu Nadia gave birth in January. Then one of my friend gave birth in March. Alia March kan?
Alia Mat.
Then yang my boss punya wife gave birth on the 2nd or the 4th of April gitu, or the 3rd of April lah, tak ingat lah. Then my kid came along on the 8th. Itu pun dah terlebih bulan.
Ya.
40 weeks. I was like, alamak, bila lah nak keluar budak ni? Aku dah tak sanggup dah.
Okay.
It's like,
Terlalu selesa kat dalam.
I nampak dia kat dia tau, pimpin tangan jalan kat lawan cakap, belum beranak. Asyik.
I was like, alah, tak sanggup. Sebabnya during my pregnancy, I cannot eat. I jarang, I try, I sejuk, I panas, whatever. I teh, I kopi. Kopi, teh, Milo, out.
Nasi. You pun tak boleh bawa nasi
I tak boleh bawa nasi.
Sama.
I tak boleh bawa nasi. I tak boleh, bau-bauan ni semua tak boleh lah. Okay. And I was healthy eating. I cannot eat anything oily.
Wow.
Kelas.
The only thing yang boleh telan, bubur.
Time tu best untuk diet
Sebab tu masa I pregnant.
Tapi lepas bersalin lagau.
So it's like macam I tengok all my colleague macam Nadia, alamak gain 10 kg.
You know what? We went buffet. 3 heavily pregnant women.
I can imagine. Humpty Dumpty.
I ambil kan, tapi I tak boleh makan.
You know,
Makan.
dia tak boleh makan. I was a moderate eater sebab I more to soup and susu tau. Tapi our friend tu, ya Allah, duduk.
Bangun, duduk.
Alia ada gumpak masang kau.
Dewi.
Dewi.
Wow, she's incredible
Yes.
eater.
The most incredible eater.
Tapi badan tak besar
Sebab dia naturally she's petite. Tapi she gain, but she gain 20 kg lah. All of them gain a lot. Except me.
20.
I gain more than 20 kg. I shall tell you soon.
Okay. So mine, I gain only 7 kg. So masa tu pergi jumpa doktor kan mengadu lah. Mengadu nasihat. Dak, how come my weight not as much as my friend? Good lah, everything goes to the baby. Then later when you give birth, you still slim. Kepala otak kau slim. And because I was breastfeeding kan. So because I was breastfeeding, so I took that jab lah. Because tak nak conceive kan. Sekali took that jab.
jab apa?
Bloody jab lah. Sorry.
Bukan yang masuk. Bukan
It was a jab.
Hormone jab.
The hormone jab. Oh, okay.
Hormone jab. Yang kena
Yeah.
repeat every 3 months.
No,
is it?
it's I can't remember.
It's just you need to take it 3 months once.
I tak ingat lah.
Okay,
Long
okay,
time.
okay.
Because
So
of
I
breastfeeding.
took that jab. Then masa tu lah membuat. Serious. I put on weight after that.
You know what?
Hormone.
Nadia,
Because
Nadia,
hormone.
I teringin nak makan Burger King. Nadia, I cakap, El, I know you breastfeeding tapi you makan semua benda-benda yang salah. Macam nak kurus. Yeah, I really have the luxury of breastfeeding tau. So I envy mak-mak yang breastfeed. And she is like full-time breastfeeding and yet she's eating like, wow.
How long were you?
So then nak jadi
This one
cerita.
very
Lepas tu, I think after I gave birth in April.
No less than a year when you conceive.
Yeah. So I think was in August, September or October. I got to know I was pregnant again.
Kerja. Cepat betul buat kerja.
So 6 months.
So pregnant again. So bila dah pregnant tu kan, mula-mula I tried lah. And then masa tu susu pun dah tak banyak. So I just told my mum, because okay, I was more to my mum sebab my husband was masa tu Jerry was working still back in Malaysia. So I was a lot with my mum. So I said
Mak
tak
juga
boleh
kena
lah.
cari,
Tak larat because masa tu kerja shift.
Yeah.
I think it's because of the shift work. So you tak ada macam orang selalu pergi office
Regular
pagi,
hours.
malam dia banyak susu kan. Macam I tak because it's like it always change. So last I say I just tak nak lah, kasihlah susu. And then kebetulan Ariana, my firstborn, dia pun jenis tak cerebit. So okay lah, you kasih apa je dia makan, kasih apa je dia minum, you know. So okay lah, no issues. Then they got pregnant with the second one. Second one tu yang
Masa you pregnant with the second one, susu you dah tak banyak ke?
susu I ada. Tapi tak banyak sangat.
Oh, ya
Because
ke?
I blame it on the shift work.
Oh, okay.
Stress.
More of your stress. Okay,
Because of the
Not
stress.
because you conceive kan?
No,
Because
no.
masa I conceive, my susu makin berlambak.
By right, it
Kita
should
punya
be.
shift work is quite stressful.
It's the work itself lah, the environment.
Because it's rotating shift.
her job is
It's not fixed shift. Like for example, kalau 1 month you on morning shift or 1 month you afternoon shift, it's fine. But this is like every few days you tukar. Kadang-kadang morning, kadang-kadang night.
Yeah.
There's sleeping lah. Inconsistent sleeping also affects us.
Yeah.
Yeah,
I
correct.
think it's hard that way, Kak. Because I guess if let's say you are saying that it's a fixed shift, then your body tahu tau. Macam example
Yes,
let's say you balik rumah pukul 9 malam. By 9 malam your body is ready to release the milk tau.
Yeah.
But then if let's say ni hari balik 9 malam, besok balik 12 malam,
Body kau
besok
pun,
balik
apa ni?
Yeah, exactly.
So the body don't know when it should build up, when it release.
Correct.
So bila pump susu kat office tu tak banyak lah. I get 2 ounces, 3 ounces the most, you know. And then it's like you spend so long trying to pump susu.
Yeah, I really salute those mummies yang pump while you're working. Oh my God, it's a really tough job yang you do. So
Imagine lah. Okay, kita teaching, right? So our periods are already allocated.
correct.
Then some days we have back to back, and then there's only half an hour kita nak makan, kita nak pump, and then dari my food lab nak pergi atas breastfeeding room,
Jalan jauh.
dah nak kena jalan kan. So it's like 15 minutes pump, tengah makan, tengah nak wind down, just to rush.
makan.
Exactly. Just to rush back for the next lesson. So it was quite difficult. And I have colleagues who pump 2 to 3 times a day. I am so blessed because my husband bagi I ambil lighter workload. So by 1:30 I'm back with my kids. So I only pump once a day. So I have seeing people mummies doing like 2 to 3 days.
Correct.
In between lesson, then in between CCAs, Masya Allah, they are really amazing. Yeah, mummies, you guys continue doing what you do best. Yeah.
So you conceive second one?
So after I conceived my second one, masa tu I remembered I
We were
was
at BCP.
Yeah. So second one I was at masa tu time SARS.
Yeah,
Yeah,
SARS.
2003
We will
SARS.
move. Kita orang move to a different building
ya Allah.
Period.
Masa tu dah lah tempat tu jin bertendang. Office dia pun tak macam mana. So but before that, in my early trimester lah, I found blood stain on my bra. Okay, so masa tu I pakai white bra. So I was
What? I was like confused.
Yeah, that's right. I thought
listen. I was pregnant with my second one. Okay, so during in the first trimester tu,
It's
I
more than what
nampak
you
ada brown
would
stain.
expect.
Okay, brown stain. I cakap,
Okay.
apa ni? So I biasalah pergilah doktor Google kan. Doktor Google. Oh, sometimes dia kata sometimes it's normal. So okay lah.
Clock ducts or something,
whatever lah kan. Okay. Tapi lama kelamaan macam I started to doubt lah. Until let me see
You cannot
oh
really trust
no. So bila then I told my gynae. Then my gynae referred to a visiting because KK dia ada visiting doctor from this Changi hospital that does like for breast cancer whatever semua tu lah. So the breast doctor lah I call her So went to see her, then she did because masa tu tak boleh buat mammogram, right? So did the normal check the normal physical checks. She said, oh, I don't think there's anything to worry. But never mind, I'll see you next time lah. Sekali next time, that's when SARS they stopped all doctors visiting doctors into KK. So I was like, alamak, macam mana ni? So there's no choice but to go private. As in, I go to Gleneagles and I met up with Dr. Susan Lim. So she was telling me, oh, I have one of the best machine, that can tell whether there's anything wrong with your breast. So she did the breast imaging. Oh no, I don't see anything. Okay, nothing wrong. But anyway, because you see got stain, right? There's stain. I give you this one small jar. So whatever you do, don't massage your breast. Okay, I give you this. What if let's say you can manage to squeeze out anything, you just put it in this tube and send it to the lab downstairs. Kata macam tu. Alright lah. So move on to second trimester, then early third trimester. Then suddenly one day I woke up, my breast was so hard as a rock. Oh, freaking hard. It was really hard. Then I was like,
Macam gosh gitu lah.
Mastitis.
So it's like one breast is fine, but the other breast is not. Something is not right. So bila macam tu, then padahal doktor dah cakap kan, don't massage.
Don't massage.
But then I thought, then my mom would say maybe sebab dah susu. Because it's normal, third trimester kan.
Mungkin tersumbat ke.
So panggil lah tukang urut. So
We all been there. You sebab tu dengar.
Sorry, episode ni panjang sikit sebab
so bila panggil tukang urut, so she urut and bright red blood came out.
Did you get deep inside the container?
Yeah, I did. So I did. Then I think that was on a Saturday. Then I pass it to my husband. I think I followed my husband. Pergi Gleneagles. We made it just in time before the
Collection point,
the clinic closed. So balik through in now. Then my husband pun balik because he comes back on Friday night and he goes back on Sunday. On Monday, I got a call from the doctor. I've already got your results. Can you please come with your husband?
Oh no.
What do you think?
Oh, something serious.
It's definitely something is not right. So I called my husband. My husband ni baru balik kan on Sunday. Saya cakap, Dak kata result dah keluar. And she say you need to be here. So he said, okay lah. So that was a Monday. Monday evening tu dia ambil bus. Masa dulu mana ada Air Asia. So naik bus je. So he took the 6 o'clock bus. He reached Singapore around 12. So the next day, I think was sometime almost noon, we went to see the doctor. And the doctor was there, Susan Lim, and she has a psychologist beside her, and I was sitting here. My husband was sitting, I can't remember here or here. I have some news. I'm sorry, it has a bit of bad news. We found malignant cells in your breast. So masa tu kan macam terasa macam you tengok TV yang dung dung dung, that kind of effect. Macam tu kan. I was like, tak ada emotion, I cannot break down. Because your head was still processing it, right? It's like, but you see, you cannot see anything wrong. Yeah, I know. But, sometimes these things can be very unexpected lah. Machines can only catch as just that much. Okay. So, but whatever it is, because masa tu I was 32 weeks. Okay. So, 32 weeks, but whatever it is, I think you can, because your baby's heart is still not developed. So, we will wait until 36 weeks. Okay. So then she wrote a letter. Then she say, I will call doctor. Masa tu my gynae is actually Dr. CC Kong. I think he's still at KK now. So
Hi, Dr. Kong.
so she called him, or is it she wrote a letter to him? I cannot remember. I think she gave a memo. Then I went to see Dr. Kong. Sebab masa tu dah third trimester, I was seeing him every 2 weeks or every week.
2 weeks.
Gitu. So I gave him, then he was like, oh, okay. Oh, so she recommended to wait until 36 weeks. Okay, fine. We wait until 36 weeks. And that, we were still at BCP. So masa tu,
Dia makan, aku makan. Dia tak habis, aku habis.
And the thing is that the first pregnancy, I cannot eat. Right? I cannot eat, I cannot smell, whatever. This second pregnancy, I can eat better, slightly better. I can push myself to eat. Okay? But
Tapi tak habis juga. Hitung sampah.
Sebab masa tu, I had a lot of nafsu. Nafsu nak makan tu ada. So I can eat. But nanti macam hari tu, I ingat ni. So we were at Pickering Street punya hawker centre tu. I ordered gado-gado. Makan satu, sedapnya.
Tak cukup Nadia?
Tak cukup lah. I nak beli lagi satu Okay. Makan sikit. Alamak, tak habis lah Nat.
Kata kat dia.
Habis? Siapa nak makan ni? You tolong habiskan.
And the thing is that when I started eating, then later on I found out I'm blue.
Yeah, so literally I was about to give birth and she was getting pregnant.
Okay, the other way around
So,
now.
pregnancies together.
Almost quite a gap lah.
So bila dah jadi macam tu, then after that, while at BCP tu side, then my gynae called, I don't think we can wait lah. We have to make sure you give birth very quickly. So masa tu I told him when I was 33 weeks. So dia kata, you come next week. I'll give you the steroid jab. And then
Sakit.
I give you the steroid jab
Sakit,
because develop your baby's heart. And then we will
The lungs will be stronger.
over the weekend. Then you deliver on Monday. Dia kata macam tu. Oh, okay. And then at the same time I got a call from my aircon man. Misa, how to put your aircon how much because masa tu I baru dapat rumah.
Oh, I see.
I
So
baru dapat
everything
rumah.
comes at once.
Yes, everything comes at the same time. So masa tu lah baru nak cari kontraktor, nak letak ini, nak letak tu, whatever kan. And then I don't have the luxury of most people where the husbands are with them. I was completely on my own. And my parents. My parents will not really interfere with my house. So literally I do everything on my own, you know. So bila dah macam tu, okay, tak apa. Then he say, we cannot wait. So okay lah, next week. Next week, that means I was 34 weeks when I deliver. Okay. So I think they gave me the steroid jab twice.
Aduh.
Twice ke once? Tak ingat
I
lah.
only had once for my.
I can't remember twice or once lah. I tell you, it's one of the most
Painful jabs in your life.
most painful jab you can ever have in your
Any
life.
jab is painful to me. This one is steroid. Oh my God.
sakit gila. Dia
You imagine
cut your thighs.
dia inject kat thigh kan.
Oh.
Pain. I punya threshold of pain I think is still quite high lah. Tapi when they put in the steroid, it was like, oh, it's so painful. Don't push. Slowly. I'm not pushing. I don't push. I'm not pushing. I don't dare to push when you say pain. I'm doing it very, 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 very slowly. But it was the most.
It's when the liquid
Go
and
in,
masuk.
yeah.
I assume that the molecules are huge.
Yo.
Okay,
So then Nabil lepas tu you gave birth.
I gave birth. So masa tu depressed lah sebab with Ariana, she came out 3.88.
Without eating,
Without eating.
That's why miracle.
3.88.
Gain 7 kilo je.
And this baby was in an excubator at only 2.1.
Still okay lah.
Still
Above 2 is okay.
But you see the drastic 2
Yeah.
and almost 4.
Yes.
So it's like, she's so tiny. She
Macam
cannot
gini
even
kan, macam gini kan. Frozen
she
chicken punya size
she
tau.
cannot even wear the pampers, you know.
Yeah, correct. For
So
for
sedih, and
infant,
then you
for
had all
newborn.
the wires going in because dia masuk through the apa ni, tali pusat kan, all the nutrients masuk through the tali pusat. And I was telling myself, oh my god, what have put you through? You know, I was so sedih, you know. I cried and I cried and I cried. Masa tu lah second pregnancy. But Alhamdulillah, 5 days she spent in an ICU. Then 3 days in nursery because she can suckle. Then brought back. Masa tu, you imagine lah. Then 2 weeks later, I gave birth to her in 2nd June. 2 weeks later, I think I had the operation done on the 17th of June. It
Your
was
operation.
my operation, and that was 2 weeks shy of my 2nd anniversary.
MashaAllah, everything happened so
Yeah.
close
Yeah, so
together.
close together.
You're such a strong woman to go through
masa
it.
tu, I'm like,
I guess people who don't understand.
Yeah, you know when she called me and tell me the result, right? And that time I just found out that I got pregnant. You imagine I cried buckets over the phone, you know. I said, Lola, I'm pregnant.
yeah, it was, but Alhamdulillah lah, I think because,
I guess for those who don't understand, Kak Air is a breast cancer survivor. Alhamdulillah.
so,
Alhamdulillah.
and then, nak jadikan cerita, I ni very subuh. Then I got pregnant with the third one.
Padahal miscarriage, eh?
No, I got pregnant with the third one, and masa tu I was, yelah, Allah tu beri rezeki in many forms kan. Kebetulan, because I was considered young age, then the type of cancer cells that I had matches with that clinical program that they have. Okay, there was a trial. So I was in that program. So masa tu mula-mula I was just a placebo, meaning to say I don't take the medicine.
Okay.
So they just monitor me as a monitoring itulah.
What they call control lah.
Control, yes, exactly. Thank you Lala.
Science student.
So control. So sekali bila because I was under control, then I got to know I was pregnant. No. Masa tu it wasn't, belum lagi. So
Tak kisahlah, when you had your third
okay,
pregnancy,
so and then
what
after that third pregnancy tu, then after that I kena makan they offered me ubat because they had the initial punya result that is very promising. So they say you take this. My mum, I dah tak nak because I phobia daripada the chemotherapy was enough. You know, I don't want to go through it because this is exactly like chemo one more time. So I didn't want to go through it anymore. Then after that, but then that jab tu, that treatment, one treatment is 15K.
Wah,
Uish.
ya Allah.
Yeah.
15,000.
15,000.
Wow.
And it's a every 3 week cycle. My friend, another breast cancer survivor, she also went for it, but she paid and she had to lapse it. That means she had to, instead of 3 weeks, maybe she put dijauhkan.
Because she's paying.
Because she's paying.
You were given it.
Because my mom, that's why my mom cakap, why don't you just take it? Kau tak tahu nasib kau macam mana. Ambil je lah. Ini boleh bawa beli kereta. You know, bila masa tu kan kereta murah kan. Kau boleh beli kereta, my mom cakap. So, and it may, because the results are promising, just go for it. Okay lah. Sekali, when I decide to go for it, dapat tahu I was pregnant with the third.
So tak boleh.
So the doctor say, my doctor lah, Air, I am all for being pregnant, dia kata. As a matter of fact, my wife is also being pregnant. Oh, I tell you, I have the most charming oncologist.
What's his name?
Benjamin apa?
Hey, he didn't buy airtime. No need.
Okay, so anyway, so I had no choice. Dia kata, one thing is too soon because your first one, in less than 1 year, you conceive your second one, and now in less than 1 year, you already conceive your third one.
So what do you have to do with that third one?
So dia kata,
You are just conscious of time.
yeah. So I had no choice but to go for abortion lah.
Ha? I see. Ya Allah.
Tapi at how many months?
So
very early,
yeah. So
Ya Allah.
the doctors say the best is by 10 week, and Masa tu I was eating very well. The third pregnancy was so different. I can eat, I can do anything.
Circumstances lah that we have no choice.
Kesiannya.
But highly, I mean,
Because it would
advised
risk
by the doctor
your
to
life.
not proceed
Yeah,
lah.
not because it's too risky lah. So at 10 weeks I gugurkan, but masa tu tak fikir apa, I just left it at the hospital. Macam, you know, at least Aisyah you get to bring back.
Masa mine dah 14 weeks.
Oh.
Dah
masa
nampak
tu,
muka, dah nampak mata
rupanya I could have requested.
Oh.
I didn't request. I didn't know.
Also so many things inside the head lah.
Yeah.
Nak terfikir nak bawa balik ke.
Yeah, so
Wah, this topic terlalu interesting.
Yes.
All of us have got so many things to go through.
yeah.
Yeah.
That's my story.
So itulah cerita Kak Erin. Next.
Me, right?
yes.
Last but not least.
Kak Rada haven't.
No, Nadia belum.
Okay, apa
Kak
tu?
pun belum. Sorry.
It's
My
okay. No worries.
because I'm very lasak, right? So I my first 2 pregnancy was very smooth. No headache, no motion sickness, no morning sickness, no sickness. So that's why when I see people, when I see perempuan yang macam like
Macam-macam signal.
macam
Macam
like,
mengada
Tak faham macam
Kau tak faham. Kau tak faham perasaan kita, Dik. Kau tak faham perasaan kita, Dik.
so macam like why? Or those yang jalan pegang perut, or like those jalan
Pegang belakang.
Yang duck walk ke apa
yeah,
ke.
like like jalan mas pegang perut type. I feel like come on lah.
It's like you're overdoing it gitu
you're overdoing like
Dah kena batang hidung, padam.
makan sabun pun okay, dah merepek already lah. But then like I feel like why so much work into it. Then,
Drama.
Yeah, just so because I'm the lasak type. So alhamdulillah Ajani and Adriana was very smooth. No nothing at all. So even though I don't look good lah. I'm like I really like don't jaga my rupa everything like that, right? But then it's just that
I mean
feel,
what? You look like when you're pregnant these two?
yeah, like I just datang as I am, like just t-shirt and slipper because I have 2 job place. When I got pregnant, I was in DBS already, right? So it was at Toguan. The main office is at Changi. So in Toguan is like your own space, like no big bosses. So
Pakai baju rumah ke bekerja?
kita datang pakai slipper. Saya contact center apa?
Oh, yalah.
So kita datang really pakai macam like slumber je tau. So betul. Then every time when I can katakan macam I trick DBS yang they hire me when pregnant lah. So when I went for
DBS, you didn't hear that. You didn't hear that.
so when I went for the interview, I was already pregnant, but I didn't declare it. So when we started training, I passed. Then after that, straight away I had like 6 months maternity. So macam kira kan macam sini ni macam tipu lah. But
Nanti because of you, they put clause tau.
kira macam
Ni pasal jenis pregnant anak perempuan tapi selekeh.
yes, correct. I'm the selekeh one. Correct. I'm the selekeh one. Then, so bila tengah buat class lesson kan, I tidur like openly tidur. Perut dah besar apa tidur. Then, but everybody cover me lah. My teammate all will cover me. Then after that, then when part exam or like time to answer that, anak orang kena cubit. Then later they will tell me. But I'm really the lasak one. So like really nothing, no vomiting. You can drive all.
For
I'm
both
okay.
Adriani and Adriana.
Yeah, correct. So when time pregnant with Ajani, we went for the private hospital, right? We went to NUH. So when we went to NUH, the nurse said this thing about don't. You know how when you say don't, then you will do it, right?
Yeah.
So they say don't angkat your buntut.
When you gave birth.
Yeah, when I gave birth.
When
So-
you're trying to push lah kan.
Correct. So I angkat my buntut. Then after that I tolak. Then I had 3rd degree tear.
Allah
Kan?
Sounds painful.
Aduh. Tak dengar cakap orang, dia gila dia ni.
So I had, really. Then
So nurses out there, if you don't want to do them to do something, say it, then they will not do
Yeah,
it.
they won't do.
yeah, correct. Then so she say don't angkat buntut. I said okay fine. Then after that, so tolak. Then I angkat buntut. So like really like koyak ah.
So you just hear the last 2 words angkat buntut.
I don't
You
know
don't
what
hear
I don't know.
Selective hearing.
So, no,
That's Adriani.
Yeah, that's Adriani. So they had to do the stage, and then also when they all said that don't shower after that, right?
Then you shower?
Yeah, I shower
Because
I
they say
cannot
you just take the last word lah.
But
Don't
why they say
shower.
don't shower? That one I disagree.
Dia nak kering.
No, because they said like you tolak, so like your pores are all open, so
Yeah.
you cannot shower. then after that, then it will
Not like immediately shower.
yeah, correct. But then I did whatever that cannot do, I would do because
I
it's
did
so
for all
lekit.
my four,
Yeah, because it's so lekit, right?
Yeah.
So I showered.
Bau kita.
So I showered also. But then before this, I like to talk to a lot of people, right? So when I talk, there's this one of my Kai friend was so funny. He say, whatever it is, when you go in, ask for epidural because it's like heaven and hell. So that's what I really did. So when we for Adrani wise, I asked
Hello,
epidural.
Malay.
So jadi bila time masa Adrani
Bila waktu saya melahirkan Adrani,
ya. Macam gitu. Then apa tu, I try to tahan sikit lah then contraction. But then I felt like then another thing the person said, you just ask only because you ask now or later or then the price is still the same. So when I felt the first 2 contraction, right, I said, doctor, give me epidural.
It's a mindset lah.
Yeah, just give me epidural. Then after that, then doctor said, okay, can. So he asked to crouch. Korang ambil epidural tak?
Yeah, I did.
Sorry, Nan. I didn't.
That's fine.
You alternated you use epidural.
Yeah.
Lepas tu I bear through it.
So I did. I saw they asked to crouch. Then after that is a long needle. According to Kyla,
Yeah,
it's a long needle.
needle.
Kan? Then they will poke the spine kan.
The reason why I bear through it is because of that needle.
But for me, right, the needle wasn't painful. I think because the contraction was more painful. I don't know, maybe
Really it overlaps.
Correct.
lah.
Yeah. So when he say when you feel something, then you tell me. Then after he will do the injection. So, but it was really betul tak. Lepas contraction tu, I tell you, I watch handphone macam tak rasa. Dia suddenly the thing
Boleh
like
rasa keras je, perut keras.
no, because it's like numbing, right?
yeah.
Isn't epidural to numb you?
Yeah, correct.
Is epidural is the one that like for
You boleh dengar
for
lagi.
half body
C-section,
something like that.
epidural. I lah.
numbs you down kan?
Then
All the way to the leg.
Yeah,
Vagina.
like half body cesarean lah.
Yes.
Yeah, so I really did only suddenly like
So you terus
then
tak
like, oh
rasa
okay,
apa?
okay gitu je.
Then the sensation whether you're pushing or not? Sorry, that's like how to feel whether you're pushing or not.
Cannot
You
feel.
won't feel anything.
So
Then
is,
you will have the monitor?
Monitor.
The monitor.
so the epidural
What, they help you to push?
No, yeah, they will.
No,
The
they
monitor will be
lower
there.
down. They lower down so
you
that
try
you
your
can feel.
best to push, but you don't know whether you push or
Oh,
not.
the
lah.
epidural is not just an injection. It's like a drip.
No, it's actually
running thing,
no, it's
yeah.
actually it's a ball. So I find out from my second pregnancy, it's a ball they put inside at your spine. Yeah, correct. Ball. Yeah, it's a ball.
That's why the after effect is those who wear epidural kadang sakit pinggang.
Yeah, it's a ball with thread. So that one I found out from the
Ball with
second.
thread.
It's
Then
a,
they take it out the ball.
after.
Oh my god,
Yeah.
seriously?
So that's what I find out.
Are we
So,
scaring you?
No, I took epidural.
Oh, you do?
I took. So it helped me a lot. I tried to tahan my contraction for 17 hours.
wow,
Oh, yeah,
17 hours.
And I was only 0.5 dilated. So that's when I decided to use epidural.
For me, the reason why I went for epidural was because bila masuk kan, dia dah seluk kan doktor kan. Dah dengan jari.
Sakit.
Fat
It's so
finger.
painful.
Dia masukkan and then just, tip of the finger. Tip of the finger. So it's like, but because I had oxytocin. Because I was induced kan. Masa the first one, Ariana, I was induced because 40 weeks kan. So induced. So masa tu is like, sakit bukan macam you all, you know, macam yang orang beranak biasa is like there will come a time when you have the contraction and then after that you will have relax period kan. For me is no oxytocin, as long as the oxytocin is dropping, it's like the entire time. So no choice but to take epidural.
Allah.
Yeah, so that one, the doctor say don't eat or drink anything. Because I think when you give birth, then takut later you also terkencing or something,
Of
right?
course you eat and drink and eat something.
Yes, of course. So I have the kurma bottle and all.
Okay lah kurma. Ingatkan dia makan apa.
No, yeah. Then after that, so macam gitu lah. Macam like confirm like macam that one also 2 trip because at first I thought water bag burst. Then after that when we went to the hospital NUH cakap this one nothing yet, still small dilation, you can go back. So we go back, we tidur, then we go again. Then this time I asked for the epidural, etc. Then we went inside. When they say, okay, now it's time to deliver, I'm going to lower down the epidural. Then after that, you let me know when it's time to push, then you push lah. So journey was okay. Everything was blah, 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 smooth. Until the part that they say, okay, push. Then when I push, I angkat my bontot. Dia pergi koyak. Skap. Then after that, the doctor have to stitch. So stitch-wise, think also maybe because of the kurma lah kan. Then your stitching all heal very fast also. So Ajani was okay.
Okay, adik-adik semua bawa kurma masuk ward.
So that it heals very fast. That was my first one. The second one for Ajana was much better. Everything was much better. Ajani kirakan macam
Eksperimen first time.
dia first timer. Correct. First timer tapi dia dapat semua barang mahal. Because first cucu right. So macam like my mother masak
Sponsorship dia kuat.
banyak kuat. Dia keluar pun kuat dia keluar pun dah ada gelang semua tau. Correct.
Steady.
Everybody pun nak kasih something. So Adriana macam the second time also very smooth also. But then this time round when I want to go delivery ward ni, I walk in aja tau. Then nanti ada counter dekat the delivery ward. I walk in aja. Okay nurse, I want epidural. Then the nurse like, but you just sampai. You sure you don't want to try to wait? Then I tell Kai, no, don't need to wait. Then I just walk. Then the two nurses look at Kai. Then Kai was like, yeah, she want epidural.
Knowing Kai.
So I said, okay. So then straight away, so she put in the epidural. But for Adriana, when it happened, right, I think somehow, because when they say when you do epidural, you don't sengetkan badan. So when that happened, I think this side was more numb. So my contraction, I felt
Dia punya ball tu more to the right
Correct. So I felt
Makes sense.
Yeah, I felt here.
Yeah, because it's not easy, you know. You perut besar, then you have to crouch. You have to go in a fetal position.
Yeah. So then
macam udang position lah.
correct.
Then
Then the doctor came in. Then he pumped some more. So when he pumped some more, right? Then when he pumped some more, that one I felt like he adjusting. Dan the tali. Adjust. So then that one I think ada satu video kan, Kai also peep kan. So Kai was like, Lala, can you raise your right leg? Then after that I semangat like, tapi my right leg cannot go up, but my left leg still can go up. Then after that we call the person, then the person adjust again. Macam you can rasa macam dia tarik dan itu. Then after that I was okay. But Adriana one, when we give birth, I gave birth was easy. I think because maybe the body dah biasa kot, right? Yeah. So Adriana came out.
You didn't go through a shock lagi tu second.
Yeah, correct.
Then the twins?
Yeah, so for the twins wise, also epidural also. But then for the twins wise was...
How was the pregnancy?
That's the thing. Because the twins wise, I think maybe I talk too big lah. You know, my first...
Apa ni macam ni? Jangan tak abu. Kali mulut tutup.
Jangan suka cakap pasal orang.
Tak lah, pregnancy perempuan senang lah. Lelaki tu yang si bebet tu.
Salahkan lelaki juga. Kita memang harus salahkan lelaki saja.
Harus.
Perempuan tak pernah salah.
Ya, kalau tak berhenti dekat girl, I won't dapat itu kan. So that's the thing about when with the boys, because they are twins, right? So the boys are a bit different because they are of the same sex. Same umbilical cord also. So that's why for the boys I have to go correct.
Boys?
But identical can be also but now it's the same umbilical cord. So if I makan they will like somebody will eat more.
So were you advised to eat more?
No, I wasn't. No, yeah, because the boys I was big, but then they are very small. So it's just that the boys wise, right? They are macam nak cakap Aryan had more food. So because of Aryan eat more, Aiden was very small. I had to come down every week. Yeah, every week for like about 4 months gitu. Every week.
Untuk apa tu?
To monitor
Monitor the other baby that is not growing enough.
Correct, yeah. So at
Tapi
that
sekarang semua dua-dua sama saiz
dia kembang.
No,
Dia
both
tiup.
inside.
Dia kena tiup. But then, yeah, but they said even though they looks big now, right? This 500, they are 500 gram apart. So this 500 gram will maintain. Apparently, yeah. So I had a...
Kalau sekarang aku tak tahu which one is which one, I just put them on the weighing scale
boleh juga.
I still don't know which one is which one.
Sama sangat.
Yeah, because I have a colleague in Trust Bank also. She is the identical one. She says she and her sister also the 300 gram is consistent.
I didn't know that.
Guys, amazing. You guys yang tak tahu. This is something new.
I didn't know that.
That's
So
why I
it
also
follows you into adulthood.
yeah, all the way. Yeah, she said don't know why.
Now cannot cheat. You check the weighing machine.
Yeah.
Stand up. Then, so for the boys.
So how was the pregnancy?
Oh yeah, tu merepek lah. The voice was really merepek. So driving wise, ada sikit I will open like randomly kat traffic light, open the door. Buta.
Oh.
Then after that, habis tu, then every time will blame Kai. You lah, I done with 2 girls already, you still one boy. Marah. Kena. Then after that.
Harus.
Then,
Padahal siapa yang nak?
wait. Dia lah. So that one. Then after the next one, if also go toilet, boys or the 2 girls change pampers also I cannot. The ammonia smell very strong for me. Yeah. And apa lagi Oh, and then orang satu hari Kai ask me to like say lah why like the house so messy. I go to the corner of the sofa, I nangis.
Ini baru betul ya. Pergi ke bucu katil dan melalak.
So then joke sampai sekarang tak nak pergi sofa, nangis.
Like you literally go and cry.
I go and cry. Then I cry. Then
Bukan buat-buat.
Bukan. Dan lepas tu kan ambil backup, pergi telefon mak bapak dia. Kai suruh orang.
Mengada-ngada. Tapi itulah orang cakap kita kadang-kadang tengok orang lain pregnancy cakap I won't be like that. Tapi bila dah kena kat kita baru kita tahu macam mana. Because different pregnancy, different style, different cara.
Tapi but all mak anak the consistency is makanan India.
Ya, sampai sekarang.
Sampai sekarang.
Andai kan makan pregnancy je.
Sampai sekarang. Pergi luar je mi goreng mama.
Muka Cina tapi makan India.
Mata sepek.
And they all love Indian food.
Dia orang love Indian food. Except for Aiden, dia macam tak accept dia Melayu sikit lah. Dia kena fish and chip gitu lah.
Dia kena fish and chip.
Actually considering your 3 pregnancies tu kira kan Alhamdulillah.
Alhamdulillah, correct.
Ni benda-benda ni semua masing-masing rezeki lah.
Correct. But then for the boys, tu terbawa to delivery wise also same thing, masuk terus minta epidural. Then after that for them right, when I want to give birth, both of them dah face down, but when it took me 20 minutes apart for Aryan to come out, then Aiden come out. Because
Do you still take the epidural within that after that 20 minutes?
no, they lower down the epidural so that you can feel.
Then after that the food then 20 minutes tu dia up again lah.
Tak habis.
So rasa lah.
Rasa. So that one rasa already. So for Aryan want to come out, the gums come out first, right? So that one really took me a lot of effort already. Right. So when I managed to get Aryan out, suddenly Aiden felt that the
banyak
space
dah jadi banglo.
Betul dia suddenly
Upgrade dari kondo terus jadi banglo.
So he's floating inside the womb as
he
if
from down, he's
Jadi up.
pusing naik atas.
Dia swim
So
back up.
it swim up. No, not even pusing. No, it swim back up.
he swim back down.
Looking for the brother.
No, macam like gitu agak dia. So but then after that so I push. Then I like really like cannot idea.
Penat lah, dia dah jauh.
I was like okay, cannot, just cut me. Then the nurse say cannot because anyway it's pro natural birth.
Oh, serious?
Yeah, NUH pro natural birth.
good.
Because actually I wanted to do water birth also. That's why I choose NUH. Yeah. Water birth.
Ini kan step Mak Saleh ni.
Ya, banyak sponsorship.
Banyak sponsorship.
Habis lepas tu?
Then after that, dia macam, then I say just cut me, I really cannot. It's okay, just bring me to the next room. Then the nurse, the doctor said, no, just hang on, you can do it.
Do they massage you or something?
That point of time, the gynae was trying to push him back down. I think he still don't want lah. He was like, this too much space kan maybe. Then after that, everybody was coming in already to the room. So I had like, I think Kai from beside, right, he cannot move. He just standing beside there because in the room had like 4 nurses. The gynae, two surgical nurse, and then your intern, and the operating theatre dah standby already. Then after that, she was like saying, what he did, the last one he did was she selop dalam, pusingkan Aiden. Pusingkan dia.
On epidural?
That's what they do.
No, on epidural already. But that one, I cannot feel anything already. I think my body, I really cannot feel anything.
Seriously?
Selopkan.
That's what I read and I saw that's what they will do. That's why I was asking, did he massage? If not, that's the next thing that they will do. You know?
So he did that, then pusingkan. Then after that,
Sounds scary.
Yeah.
But you didn't feel anything.
That one I cannot. I think my body dah.
As long as you don't feel anything.
Sounds like a mystic. Oh my God, science fiction.
Dia Are you now not motivated to be on epidural?
She was on epidural.
Yeah, that's why I say, is she not motivated anymore?
Yeah.
I'm okay.
No,
I
but
still
I
have
don't.
epidural.
No, but I don't.
you
think-
want epidural?
I still have epidural.
No, but this is not because of epidural. what?
Because I takut nanti bila time birth, when I'm too stressed, I cannot push. Then I penat. I don't want to be penat.
No,
Maybe
but
because you on
epidural.
17 hours labor. That
17
one.
hours.
That one. Maybe this one, if you can, you should
This one,
try.
if no choice lah. If too
Yeah.
fast pun.
Yeah,
But I'm scared of the tear.
Oh no, no,
No, I tell you, the time most likely you may not really feel because you're already in pain.
That's what everybody
Korang tak kena potong
I kena potong. But I was
kena
on
potong?
epidural.
potong.
Yeah.
Oh, sorry, I kena potong. I wasn't on epidural.
Potong
My
there
first
lah,
was
there,
oxytocin.
I know. I was on epidural. I kena potong, so I okay.
Oh my gosh.
I think this is good, guys. Actually, I think when we talk and like inter talk between each other is better.
Yeah, we are the
That's why I wanted to ask her, is
No,
she
no, no,
not
because-
motivated to be like on natural birth? But apparently she's still motivated to be on epidural.
I want epidural. I want to relax.
Oh, you want to relax?
Some
Ah.
people just
Because-
appreciate the energy conservation.
Correct.
But some people are so afraid of the needles. But some people, they just want to be heroine like me. Macam bangga lah.
Cepat.
I tried.
Lala
Kita
bising kita.
Tim tak epidural lah kira.
Oh yeah, you also epidural
Epidural.
Cesarean. For cesareans.
different.
Oh.
Tu lagi. Okay, let's hear hers first because mine is natural.
Wait. Yeah. So
All
then the
four.
last copek was
Lala.
okay. So the last copek was the intern sit on top of me.
Astaghfirullah.
Yeah.
To my sister-in-law.
Yeah, because 20 minutes already I really cannot, right? Then I was like,
Sit on top so that the thing is pushed out.
They will sit.
She said that because Aiden was too long already also. Yeah, because Aiden was too long inside also
Is
kan.
she a light intern?
Huh? Normal size?
80
Yeah.
kg or 50 kg.
Like normal size lah. Macam both of them lah. Macam gitu. Yeah, but that one because Aiden was already too long already. And then she also pusingkan already, right? So, and I was also, my oxygen was also getting lower already. Because I really very, very, very tired already.
Okay.
So, the last kopek one, like suddenly I say, just cut me. I shout. Then I tell Kai also, I say, Kai, just tell them, I'm ready. Just cut me.
Kita boleh imagine dengan suara sarjan dia.
Then after that, Kai, I'm ready. Just cut me.
She become zombie.
So that one was really, after that, the intern just like naik atas like on top like that. Okay, I want you to push the last one. Okay, I see him. I see him. Padahal Kai say no, tak nampak say it's not there
I
yet.
think just to motivate you.
They say, okay, this is the final
So
push.
his back was on you.
No,
You see his back.
my facing me like that.
Oh,
on top of me already like that. Then I said, okay, just push. Then I said, okay. Then everybody, then Kai said the gynae all was like looking for around to stand by to tolak already all lah. Then after that, then they said, okay. Then she went up. Then I said the final push. I don't know whether I push or not lah, but I berpeluh gila lah. Then after that, then she pump like that. Then I think that Aiden came out. Yeah, Aiden came out.
Dia macam CPR
I think was
It's more of the maneuver apa yang buuk.
only one. So my hair blue black after that. Yeah.
That must be one.
Tak letak apa-apa.
Tak. Then after when Aiden came out, the thing that I felt painful was the the back came out.
Amniotic sac
Yeah,
dia.
that one when that one came out, then I felt the pull.
Itu yang
Yeah.
rasa ngeri je.
My goodness, what an experience masing-masing.
Yeah, but then when that happened, I also berak.
It's okay. You can shit on them all you want. You've been through.
Berak bukan pasal nak
But you never feel like
berak pasal dah
berak, right?
stress.
Tolak
Yeah.
sangat.
Is it because of stress ah?
I
The
know.
stress.
So actually
Power
is
dah loose.
Yeah, look, I cannot control.
Actually, because when you're giving birth, your body releases this hormone that soften all the soft muscle.
Yeah, that's why. So
So that's why it's easy orang nak berak, nak kencing, whatever masa
they always
beranak.
say don't eat too much excessive.
I punya piles keluar say when I deliver piles itu.
Because you push too hard.
I was hoping you'd be motivated to go for natural. Yeah, you said, no, I want to relax. Okay lah, relax lah.
But this is not about epidural, what? The epidural is to tahan, right? But when you are delivering, it's not epidural, what?
Yeah, I was hoping that she would just tahan the whole thing.
When I give birth,
Oh, you concerned about the tear?
I concerned about the pain when I'm giving birth. So
She
actually
doesn't be stress-free,
the nurse, when the nurse saw that I'm already macam dilated kan, they brought down the epidural. Then after that, I macam stressed, like, what to bring down? Then I pinch myself. I touch my vagina, make sure I don't get anything, you know. Really? Yeah, then I say no. Then after that, the gynae came in because initially, Danya's heartbeat was low. I had fever.
Oh,
Then
fever?
I almost had to go in C-sec because what is that? The labour was too long already. But then the gynae was positive and he was patient lah. So, where was I? Sorry. Oh, then after that, bila the nurse bring down the epidural, then the gynae came in. I say, doctor, can you bring up the epidural? I scared lah. He say, then you garang tu. I say, I already tell you, you want C-sec or you want natural? You say you want natural, so you have to tahan. Then macam, because me being me, I just senyap like, okay.
You not fight back.
I don't know fight back.
Am I giving birth or you?
Then after that, then they say, cause I can push very well, even when I cannot feel the contraction. So the gynae, okay lah, naikkan epidural lah. Yeah. So when I give birth, I tak rasa apa-apa. But the aftermath, when the epidural wears out, when I'm alone on my bed, saya tengah tidur kau penat kan. Then that's when I felt everything.
The uterus contraction. What you were feeling was the uterus contraction from what I understand.
Dia mengecek
Sakit
That is painful.
Is it?
Were you shivering?
Because I only knew that only
I
after
was.
my third pregnancy.
C-sec punya part pula. Wah, interesting.
Yeah,
We have never-
this is very interesting. We have
Did any of you do
This one always
C-sec?
Both.
Was it
But
traumatic?
mine was on epidural C-sec. So epidural
Half body.
C-sec, half body. So literally you tak rasa apa-apa. But you, because masa tu kan, you are wide awake kan. And then masuk OT.
You only feel the tugging.
Lepas tu, I was so afraid. Then I remembered this Chinese nurse. Chinese from China nurse Then she was saying, I hold on to her and say, can I feel anything? No, you will not feel. All you feel is this.
Yalah,
Pressure.
Yeah.
And when because masa epidural, masa dia dah buka, dia dah potong tu kan. What they do is they push your stomach. Push your stomach to push the baby out.
Never been through it, but I saw the process.
was yours also epidural? Or yours was
Knockout.
What
Because mine, the first one is an emergency C-sec. So I reached the hospital.
EA lah.
They say 2 cm dilated. They say just wait, nothing. Just wait it out. You know, the nurse will come in time to time, check on you. She said about 8 to 10 hours later, then you'll be full dilated and ready to give birth. So I wait. I just wait. Then I told my husband, I told Nas, I said, actually, you just came back from work, right? Why don't you go and have your dinner? I'm okay. So he really went. He went to smoke and then he went to have dinner. So he said he went to smoke at basement. Then suddenly nurse and doctor came in. Nurse checked. She said, she told doctor, she said, brown discharge. Doctor alarm already. Check the monitor. He said, not good, not good. Oxygen is low. Baby is pooping in the stomach. Naki.
Naki.
Yeah, so he said, not good, Baby can eat his own poop.
Yeah,
If he eat
correct.
He said, oxygen is low. Then he start to tell everyone, he said, prepare for emergency cesarean. So I'm like, everything went so fast for the next 5 minutes. They like lift me up, put me on another bed, they roll, and then doctor run together, and then he hop on my bed, and then they push him and me up.
They never tell the mommy. They just like communicating around you. Then you are like so confused.
No, then after that I can hear 6 times announcement. Will the husband of Rauda binti Mustafa come to the operating theatre right now?
Nakal kena panggil.
Because I told him to go. I told him to go because he just came back from work. So I said, why don't you go and have a rest? Go have your dinner. Nurse said it will take 8 to 10 hours.
Boss kena call out, ya.
So I feel like the next 5 minutes like so dramatic. He said, it's not good, not good. Then the roller roll and then he run, hop on the bed.
Macam cerita Bollywood je dia.
He hop on the bed and 6 times announcement.
Aku tengok macam cerita Korean.
Yeah.
Pasal lah
Then my husband came.
Yes.
My husband came. He said, you must sign something. We must do the emergency cesarean now. So, sign. Then very fast already. Then he said, okay, everything is fine. Your husband is changing into the suit. He's suiting up. He will come in and...
dia pecut juga lah.
After 6 announcement lah.
Partner, 6 announcement. She highlighted after 6 announcement.
Dia cakap dia kat basement. So, they couldn't call. No network.
Excuses.
Yeah, correct.
Excuses.
Then your second one?
After that, okay, after from the first cesarean, orang cakap you can still try for natural.
After within 2 years gap, isn't it?
Yes, but my doctor, I asked him, he said, not advised because the inner stomach, the inner lining has been through pressure already. And when your body cannot take pressure again, so it's best advised for cesarean, the following ones. But just to get a second opinion, I made appointment with another doctor from KK. My gynae is from Thomson.
Okay.
So I made another appointment from KK. They say about the same thing. They explain that the inner stomach, actually for those who always go through natural, the inner stomach, the inner lining is able to take the pressure of pushing and everything. Right. But once you cut before, the stomach already have a cut and they cannot take pressure. He said, because my gynae, my personal gynae asked me, your inner lining has been through pressure. So if the second time you cannot take the pressure, I have to make a choice. I have to choose baby or you. You want me to choose you or baby?
Shit.
What is this?
No,
What?
So serious.
he is a very...
Scare tactic ah?
No,
Logical,
he is somebody...
Straightforward lah.
He don't molly-cuddle you.
Yeah,
so like he will just like, okay, I choose for you 2 bedder. This is not staycation. Choose 2 bedder enough. He will just choose and then he tell you. But I think he's decisive lah. He's firm. He's decisive. So he said, if your body go through pressure, I have to make a choice. It's you or baby. You want me to choose you or baby? So
Macam Pokemon gitu
I will have a problem with that kind of doctor.
I'm okay one. I'm okay because
That's why it's you.
I need reality lah. I need reality. I also don't want somebody to mince with words. I'd rather it just come out the words and I will just digest it on my own. Yeah, so I'm okay with it. I put aside his comment. I go and seek for a second opinion. More or less, it was about the same thing. So all the rest was planned cesarean. Of course, all the rest, no more drama, no more announcement, no more.
So you choose their birthday lah.
You choose your birthday.
So I get 1st of April Fool. I get I get National Day.
You have a national day, baby?
Maurice.
I was thinking Muri was the April Fool.
I was thinking Muri will be the April Fool one.
Fatia, because hers was revolving around. He will give a range of date between this date to this date. I think her last day was Christmas, but I think Christmas doesn't carry significance to me lah. So I just choose a nice number, 2112, 21 December.
21st December.
Yeah. So the rest, no more drama. They just come in, okay, change. Then they will ask you to do this, like the crouch a bit to inject the epidural. But the first one, because of the emergency, right? I cried when he tried to inject the epidural because he asked to do this. Then my body was tense. He said, if your body is tense, the needle cannot go in.
Yeah, correct.
Then he made me crouch again. Then he made me lie down. He turned me like a prawn. he really manhandled my body.
What do you think about it?
I'm scared for you guys.
He like really twist me and manhandled my body like a prawn because he said this is an emergency. If you are tense, I cannot inject the needle. So I like obediently trying to
By the time dia bila dapat doktor macam gitu macam like
But by the same doctor?
no,
But it's a
the
different
person who's supposed to
anesthetic.
inject.
Yeah, that's the anesthetic lah.
So okay, out of curiosity, knowing Pak Nas is mischievous, I wonder how he is when Rauda is pregnant.
I was just thinking. Kan? No, yang Pak Gisbert. I was just thinking dia kat tepi Rauda kena gitu dia gini. Bila laki keluar dia gini.
That's my boy.
Sorry.
Thermomix, remember? Thermomix.
Oh, dia baik.
Oh, dia baik.
Ngidam ke, apa ke.
Dia baik. Dulu dia kerja kan.
Dulu dia kerja.
Dia kerja full time. Dulu kerja full time. So dia balik.
Sekarang dia goyang kaki je.
Dia balik, dia massage my leg.
Panas.
Dia balik.
Oh my god, panas.
Weekend dia bawa I eat my favourite food lah. Western ke, ketam ke. Dia baik. Dia baik bila I pregnant aja.
Baik ada makna. Baik ada makna.
Tapi dia baik.
Disclaimer.
Then kat long you blush nak.
Okay, I pula
I nak dengar cerita pasal Abang Bas ni.
I kan nak I step hero Mina. I
Kacau
nak
abang.
semua anak-anak I.
Wait. Pak Nas. Kita berbual pasal Pak Nas dulu Six announcement tak datang bila Kak Roda masuk emergency ward. Apa ni? Dia masuk dia.
Cesarean. The first cesarean.
Oh my god.
Biasa je. But then again Kak Roda dah cover. So you massage the leg. Okay, can dah. Bye-bye. Thank you very much.
You call him.
Yeah, come. I'm the bahan, but only I can do this type of thing, right?
That's true.
Okay, jadi kalau you all nak
Was he inside the toilet?
No.
Dengan memerut.
anybody got a
yeah.
difficult question to ask your spouse, you ask Lala to ask your spouse.
I will go.
Yeah.
Okay, can she's the first.
She does
dia
that all
the
the
first
time.
line of soldier tau.
Yes, I'm the first line and I always win my battle.
Okay. Anybody got a
Try
very
to ask Abang, see whether he answer you.
Abang Maram.
Yes.
Boleh.
siapa ada
podcast ni
soalan
habis.
yang berat, sensitif? Suruh Lala tanya. Dia boleh tanya.
Kak Lala muka tak malu.
Anyway, yours. Sorry.
Okay, so I got married at the age of 23.
23.
I got my first kid at the age of
23 girl.
24.
And then she like sweaty.
Macho lah.
She like masa-masa.
She like the tan, tall.
Dia suka ke Abang Bas? Bukan Abang Bas ke?
Oh, alah.
Ini macam smell fetish aja. Macam
So, married at the age of 23.
When young and
First
hot.
child at the age of 24.
Wow.
Second child at the age of 26. And Haziq came at the age of 31.
Wow.
So that's why I was asking, the punya difference in energy and sakit is totally different. Very, very different. Kalau macam Nadira, my firstborn, actually for her, the pregnancy was, because it's my first time, right? I gained almost 30 kg.
Alhamdulillah.
And I work in a control room with air. So there was one time bila sebab I was very big. You know, I jenam macam tadi bel.
No, I nak cakap something. So the room is control, not you
No, control. Kau ajar So what happened is that because it's a control room macam Mission Impossible kind of set up tau. Jadi everybody kalau nak masuk that room is going through this thing
Bubble door.
Bubble door. Only one person at a time.
Dah ketawa.
Can you imagine every time I masuk kena keluar balik. I masuk kena keluar balik.
Because you weigh 2%.
Yeah, because I was so big. I gained almost 30 kg. Sampaikan my big boss kat luar, dia cakap dengan apa tau? Dia cakap, the call security, can you just open the side door for her? And I go like... Yeah, and then there was one time, sebab I besar sangat. Actually, but I don't eat much. I love soup. And then I drink milk. Macam you cakap, you
Minum
parents
susu
apa?
macam air, susah.
Yeah, I drink milk. Bila puasa, I drink 1 carton of HL togok gitu. And I'll finish it. I'll finish it.
you can drink one.
Yeah.
I drink 2 to 4 carton.
No, I drink 1 carton at 1 shot.
At
One shot.
One shot, not
Wow.
one day. It's 1
So
shot.
kalau two different timing can be 2 carton.
Can. Yeah. So kalau kat office tu, we have a back pantry with the ladies. We stock up susu. So korang nak anak putih, soya bean lah, ada fruits lah. So
Tapi
we,
works. Anak you semua putih. Tapi pun you putih.
nasib baik, I punya genes stronger.
Yes.
Abang Bas.
Why he admits it? So the thing is that bila I first found out that I was pregnant with Nadira kan, mabuk-mabuk lah. Actually, I tak mabuk sangat. Tapi bila masuk dalam teksi, I will mabuk. Tapi the moment I masuk teksi, bila I keluar teksi, yang mabuk yang muntah Abang Bas.
Cute-nya.
He will go out, go like, ni dia kata, siapa yang pregnant? Baru tengah first honeymoon cakap baik-baik. Siapa yang pregnant?
So what happened to the third one after that?
Third one dengar lah kau cerita. And then lepas tu dia suka, kita pregnant kalau mual-mual kita suka makan all those like
Masam-masam.
masam-masam all that kan. Not me, my husband. So dia akan balik beli kulit limau. You know the mandarin orange punya skin?
Yang black packet tu kan.
Ya. Lepas tu kan nanti dia kata, alamak kulit limau dah habis lah. Tak, kat atas meja ada. Oh itu semalam punya macam dah lemau. I said like, what?
Makan je lah.
Dia kata dah lemau.
Fasi pula.
Fussy. So during the first pregnancy, dia yang go through. It wasn't me. And then adalah orang-orang tu kata lah, kalau suami yang ni mana suami saya.
Macam emotional tu connected lah. So.
Tapi my first one was very easy.
Dia patut you call live. Cakap Abang Bas, boleh Abang Bas share apa Abang Bas cerita.
Dia takkan cerita. Tapi jumping to the time when I nak give birth to my daughter, because my husband was a footballer, right? So pagi tu he had to go for training. So dia hari-hari Monday to Saturday actually ada training. Because Saturday or Sunday usually ada match lah. So what happened, ada contraction tau. Cakap macam nak beranak. Dia dah macam apa tau, nak buat apa nak buat apa contoh kata you pergilah training, pergi hospital dengan my mother dulu. So he was like, nak buat apa. So he went training. Then I masuk, dan cakap dengan dia, and he was doing his training, the phone was with Jang Jung. That time his coach was Jang Jung. You all remember Jang Jung?
Yes, Jang Jung. Okay.
Yeah, correct. So Jang Jung was holding his phone. So when I called Jang Jung panggil dia, then after that he rush off to the hospital. Dia masuk je, kata, so macam mana? Tunggu lah, nak beranak. So Nadira was daripada pagi, I gave birth to her after 6 PM. It was easy sebab dia kecil. Although I makan banyak, I had a lot of water retention. Tapi after I gave birth to her, I had tumpah darah. So the moment I stood up, right, from the bed kan, darah bush keluar gitu.
Ya Allah.
Clotted
Before that was not. It was really macam darah banyak. Then I was under observation. Then the nurse came malam tu pun sama. Bila I bangun, darah keluar sampai menitis tau. Then when I sat on the tempat toilet tu kan, bila I duduk, I rasa, puk!
Okay.
The big clot come out.
The big clot came out. So Nadira kira kan dia tak sakit tau.
Yeah,
Dia tak sakit tau Nadira. Tapi Nadira came out about 3 weeks earlier. Because for 1 month, I already had spotting. So dia punya sakit macam sekejap. Yeah. For Nisa, my second one, yang itu dia kuat makan. That one also I gain a lot of weight. Tapi dia kan, I wasn't prepared for the pain. I wasn't prepared because Nadira tak sakit. She wasn't painful. Even the doctor nampak macam contraction very heavy, but she wasn't that painful to me. Tapi Nisa was very painful. It's like macam barulah I tahu ini antara ajal dengan Then I was like,
Heaven and hell lah sama.
yeah, correct.
Hidup dan mati perjuangan.
Yeah, then sampai Abang Bas nangis-nangis tau. Because I wasn't prepared for the pain. I cakap sakit, daging semua tak kena. Then lepas tu, that one I almost gave up. I almost gave in to epidural. So bila nurse tu datang, and I was like so disoriented kan. That's why I tak boleh pakai gas tu. That gas makes me more violent. Violent. Dia tengok ada gini-gini tu, ada gini tau. Dia masuk, dia tonyok gini. Siapa tu? Dia anesthetic tau. Madam Nada ada gini.
Aku boleh imagine dia orang semua dia cakap.
Ini macam main yang virtual reality.
Dia tonyok benda tu gitu. So dia gitu lah. Gitu lah. Dan bila
ganas tak dia ni?
Because okay, the first time when I gave birth, nurse tu cakap kalau nak bersalin, always move to your side. So that baby nanti kalau nak turun senang. So when Nisa came, right, Nisa was very painful. So I couldn't focus on moving to the side. Pun tak mentally prepared kan. So bila dia nak cocok tu, I move to my side, right. Bila dia nak cocok, I shouted.
Cocok apa ni?
The epidural lah.
Oh, you
nak
almost
cocok. Almost because I almost gave up already. I cakap kadang-kadang, stop! I want to push. Stop. Gitu tau.
Drama.
Lepas tu dia pusing, dia tonyol lagi. Stop. Gitu tau. Habis lepas tu nurse tu pegang, dia kata, she dilated. Sorry doctor. Find another patient lah. Kau dia dah buka.
Ya, correct.
Dah buka. Pasal dah buka kena bayar, right? Kata dia find you another patient. So bila dah kan, habis bila tu tak apa. Lepas tu, lepas tu dia kata, okay Dek, you tunggu Both my first and second bidan Melayu tau. You tunggu, okay, tunggu I panggil doktor. Lepas tu dah mabuk kan. I cakap husband, baby nak keluar. Biarlah dia keluar. Apa tak tahan lagi.
Ya.
I cakap lah, biarlah baby keluar. Apa tak tahan lagi. Baby nak keluar.
Mata tutup kan. Mata
Habis lepas tu dia kata, tak boleh nak kena tunggu doktor. Baby nak keluar, biarlah. Dah mabuk oksigen tau. So then when
everybody's like
then it's like bila dah kan, then she didn't wait for the doctor. I was ready to push. I push lah. Bila push semua everything dah over kan, then she put me on the wheelchair. Dia cakap, kakak minta maaf Kak sebab tadi saya marah-marah kat Kakak. I said that no. Then she said, tak apa. Kakak faham. Beranak tu sakit.
Oh man.
Macam Haziq pula. Haziq, because he's an unexpected baby. We wanted a boy but we didn't expect to come. Because tu Basri, if you nak another one more baby, do it before I turn 30. Then after that, Haziq came lah. Rezeki Allah kan. So what happened was that Haziq throughout the pregnancy was okay. But then bila nak give birth dia tu, ini lelaki aku nak buat kelakar. Okay, because I already prepared right, myself for all the pain, right? So Haziq I had Braxton for a very long time.
Alamak.
I had Braxton. Yeah,
So
so
macam yang sakit
dia contraction
tu,
pain so I had it long time tau. I had about 2 months before I gave birth. So I already start working from home. And Haziq really full term. Jadi lambat sampai cakap doktor, can you just induce me? I want to hari raya. No, Madam Nadia, you have all natural birth, so I'm not going to induce you. So dia tak induce lah. So bila I went for ni kan, so I had to stay overnight because they had got apa that yang ada infection something they have to put on that drip.
Antibiotic.
Something like that because I got the infection, right? So was kept overnight, and then my contraction was very heavy already. Tapi my pain threshold is very high lah. My doctor so cute. Madam Nadia, are you okay? Okay. You feeling any pain? Not really okay. Very strong girl. I'm like, yeah, I'm okay. Yeah, you very strong, okay? If you
You punya doctor.
so just call the nurse, tell the nurse to call me, okay? Dia orang tua. By then, I thought dia dah macam, dah kira-kira high level tau. I was like, okay, doctor. Okay, aku kat tepi berdengkur. Tidur. Dia bila nak beranak kan, dia nak cakap, and I didn't realise that I gained so much. I gained almost 50 kg. Wow. I was from 60 something to going to 90 tau Oh, that means 30 30. It was very heavy. Bila dah nak push kan, okay, Madam Nadia, okay, hold your time. Tak sampai. Dia cakap, yang beranak ni macam kelakar. Tak sampai. Because it was so huge.
Kena orang tolong hold kan.
Tolong. Tak sampai. I couldn't reach, Kau was so big. Habis kan, dah tu, lepas tu, I rested for a while. I cakap, alamak Di, penat. Di, you can do it. I know you can do it. Mati aku kena dia apa? Nike dia.
Okay, tak gini. No, I forgot. Kai also. Kai, Lala, you can do it. You can do it, Lala. Om pergi pekik lah. Saya diam. Kan we told you the story, right?
Dia kata, you can do it dia. You can do it. Macam kau ingat aku ni apa? So he pushed. Then Haziq was very easy. Haziq was a very easy delivery. Yeah, but all my 3 kids semua water bag tak bersendiri. Semua nak kena prick.
Same mine also.
So Nadira tak rasa, Nisa tak rasa, but Haziq I feel all the pain. All the pain. Even bila doktor cut, even bila doktor jahit, even when the water bag burst, bila orang cakap sakit kan, I cakap I never feel. So bila Haziq semua I rasa. And then when
Water bag burst sakit?
Sakit. I don't know if it's a natural burst but kalau yang prick punya, doktor induce punya sakit.
Ya ke?
Yeah, because the poke.
They poke. That's why you tak rasa. Maybe because you ni ke? You
Tak, masa tu belum epidural. Because I remembered, masa tu pukul 7, dia masuk, dia terus prick because he wanted to induce the labor.
Dia memang different lah. Because Nadira dengan Nisa tak rasa.
Yeah.
So Haziq, right, all the pain I experienced, including the uterus contraction. That's how I know that is called uterus contraction. Moment where your uterus tengah contract, memang sakit. Dia punya sakit sampai I crouch, Haziq one was so painful.
Dia macam ada menses cramp
I think worse kot. Yeah, something like that lah. Then I had to have Panadol. Then bila balik
because
pun
after
sampai
the
nangis.
prick, then straight away your contraction very kuat.
Yeah. This one is the uterus contraction.
Yeah,
Tidak
correct.
lepas beranak.
Lepas beranak.
You menggigil tak lepas baby keluar?
Tak.
Tak.
Any of you? I menggigil uncontrollably. See macam
Tapi you epidural kan?
No, I don't have epidural.
Yours natural.
Natural.
Oh, mine, I
Is
did.
it out of pain?
I think my body was just in shock.
In shock.
Menggigil for all my births. Yeah, and then I also had premature 34-week baby. I had also yang macam pakai oxytocin, which is induced baby.
Induced baby.
Yeah, then Azrul punya pasal pre-eclampsia, I kena inject this thing called silver nitrite. So it's like that was during COVID.
Wah, you dah consider bionic woman.
Pakailah mask kan. Kita kena pakai mask. I said I cannot have the mask because when they inject that thing, you feel that macam something panas, and then your breath rasa hawa panas.
Wow.
Rasa hawa panas. It's like, apa sih, diorang nak matikan aku ke apa? It's like nak kena assassinate lah macam tu. So that one was my worst experience.
scary.
Yeah.
My
would
blood
have been
pressure
so scared.
286 to 283.
So that means you experienced the whole thing lah. The steroid. Oh,
steroid check for
silver nitrate. Oh.
Yeah.
Kau macam drug kau, Ming?
Ah.
Druggy.
Astagfirullahalazim.
Okay guys, that's a wrap about the episode 4 pregnancy. Memanglah this episode takkan stop punya because everybody's got a different,
Very unique
very unique. Yeah.
Everyone got their own unique experiences lah.
Correct.
Kan?
Yeah. So we see you guys again in next episode in Pet Pod.
Bye-bye.
Bye-bye.